Hi everyone, this is Dr. Shabri Hussood, GP with special interest in diabetes and Medical Director of Vidisha Health. Today is the day 5 of Diabetes Awareness Week and we are going to talk about gestational diabetes. So what is gestational diabetes? Now, as we know, diabetes is when your blood sugars are high because either the pancreas is not producing enough insulin or there is resistance to the insulin or there is no insulin at all in the body. In gestational diabetes, the diabetes is developed when the mothers are pregnant. This affects women who have not had diabetes in the past. But the good news is, if it is picked up early and well managed, mothers generally have healthy pregnancies and healthy babies. So, what happens in gestational diabetes? The body is unable to produce more insulin to meet the extra demands of the pregnancy, hence, mother ends up having high blood sugars. This affects during the middle or later part of the pregnancy and generally diagnosed between 24 to 28 weeks using a blood test called glucose tolerance test. And once they deliver, generally the blood sugar drops to normal ranges. So, how common is gestational diabetes? 1 in 20 women can develop gestational diabetes in the UK. How common is it in India? It is 1 in 5 women can develop gestational diabetes when they are pregnant. So the Indian British or Indians in UK have got higher risk of developing gestational diabetes. So what are the risk factors of gestational diabetes? Now, if you are living with obesity with a BMI more than 30, that increases your risk. Increasing age, NHS recommends diabetes screening or the gestational diabetes screening in mothers who are above 40 years of age. If you've had gestational diabetes in your previous pregnancy or have given birth to a baby which is more than 4.5 kilos, or you've got a family history of diabetes or belong to the ethnic minority, all of these factors increases your risk of developing gestational diabetes. So how is gestational diabetes diagnosed? Normally, they tend to do a oral glucose tolerance test or glucose tolerance test between 24 to 28 weeks. The mothers are asked to fast overnight, that is, they can't have any food or other drinks apart from water. In the morning, they will have a fasting blood sugar. Followed by that, they are given a glucose drink. Then, at 1 hour after the glucose drink or 2 hours after the drink, they do another blood test to see how the blood sugar levels are. Now, that gives an idea how the body has coped with that glucose drink. You might ask me, why is it important to pick up gestational diabetes and manage the blood sugars well during pregnancy? Because if the blood sugars are not well managed during gestational diabetes, unfortunately, it can cause complications both to the mother and to the babies. So let's look at what are the complications to the mother. They are at higher risk of miscarriage. They can develop blood pressure or preeclampsia. They have a higher risk of surgical delivery, that is C-section, and they're at higher risk of developing type 2 diabetes later in the life. Coming to the complications of the baby, they can be premature. They might be born with birth anomalies. One of the serious complications is stillbirth, but it is uncommon. They can be bigger babies, which will then develop shoulder dystocia during a normal delivery. They might need additional care when they are born because of the blood sugars in the neonatal unit, and they're at a higher risk of becoming obese and later in life developing type 2 diabetes. But I want to reinforce that if the blood sugars are managed well, then mothers can deliver healthy babies and mothers can also be quite healthy for future. Now coming to the gestational diabetes treatment. So you will be under the care of specialist healthcare team and will be advised to have a hospital birth, which is consultant-led maternity unit and with the neonatal unit. The specialist team might consist of obstetrician, consultant endocrinologist, a specialist diabetes nurse, a specialist diabetes midwife, community midwife. Mainly, the treatment consists of diet and exercise and regular self-monitoring of the blood sugars. The mothers with gestational diabetes will have more number of scans to monitor the growth of the baby compared to the mothers without. The only oral anti-diabetes medication that can be used is metformin. And if the blood sugars are not controlled with any of these measures, then it will be insulin injections. So the treatment of gestational diabetes can be, again divided into the management during pregnancy, during labor, and after birth. So during pregnancy, you will be getting a lot of advice regarding, what are the different types of birth, the pain relief, the timing of the birth. Generally, they plan to deliver before 41 weeks of gestation, either naturally or through induction or through C-section. They also give you advice about after the baby is delivered, how to look after the baby, what are the things to look for if you need any support from the healthcare professionals. Also, you will have advice regarding your contraception. So coming to the postnatal care in gestational diabetes, while you're in the hospital, you will have a blood test done. And if the blood test shows that you've got normal blood sugars, then they will say you can stop the medications, which includes oral medication like metformin or insulin, and encourage you to continue healthy lifestyle. If your blood sugars are slightly raised or not, they will discharge you with advice. And in the GP surgery, between 6 to 13 weeks, another blood test is advised, a blood sugar test. When they do the blood sugars in the GP surgery, your blood sugars either would have dropped to the normal range, or it will be in the pre-diabetes range, or unfortunately sometimes you continue to be your blood sugars will continue to be in the diabetes range. So now let's look at, you've had the baby, you've been discharged, and you've had the blood test. What happens in the community? So post-delivery, once you've had the blood sugar test, every time in this video when I say blood test, it will be a blood sugar test because we are talking about gestational diabetes. So when you have the blood test, if the blood sugars have dropped to normal ranges, the advice would be to continue healthy lifestyle. If you're planning the next baby, have preconceptual counseling by your GP or healthcare professionals and start monitoring the blood sugars early. And also you're eligible to be referred by your GP surgery to the free NHS diabetes program. And if your blood sugar continues to be in the pre-diabetes range, again, you should be continuing healthy lifestyle. You are eligible to be referred to the NHS diabetes prevention program by your GP surgery. If your blood sugars continue in the type 2 diabetes, then the treatment is according to the previous video where we talked about the treatment of type 2 diabetes. So mothers with gestational diabetes are at risk of progressing to type 2 diabetes 50% of the time in the next 5 years if no action is taken. So please take action and follow the healthy lifestyle. And your GP surgery or your doctors should be doing annual HbA1c test just to see whether your blood sugars are in the normal range or whether it is progressing towards either pre-diabetes or diabetes for your lifetime. So these are the resources. One is from the Diabetes UK, the other one is from the Royal College. Now I know that this video has got a lot of information, but it's really, really important because 1 in 20 women in UK develop gestational diabetes and 1 in 5 women in India develop gestational diabetes. So my take-home message for everyone who are listening is to be aware of your risk factors to develop gestational diabetes, get a blood test done if there are suspicions, and maintain or intensify your healthy lifestyle with respect to diet and physical activity. Be regular with your medications, go to all your diabetes appointments, and if you're planning your next pregnancy, please have preconceptional counseling from your doctor and start monitoring your blood sugars early. However, I just want to stress here, if the gestational diabetes is well managed, majority of the times mothers will have healthy pregnancies and deliver healthy babies. Thank you for listening. And if you have liked the video and it was informative, please like, share and subscribe. Thank you.